Good day to everyone. It's my pleasure to give you a talk called Mistreatment of Older Persons in Time of COVID-19, the lessons that we learned from the first wave. My name is Marie Beaulieu, and I did prepare this presentation with Julien Cadieux-Jeunesse, which is my chair coordinator. I'm the chair holder of the research chair on mistreatment of older adults, and this chair is funded by the Quebec government as a part of a plan of action that I will present in a few slides. I'm a full professor at the School of Social Work at University of Sherbrooke, where we also have a PhD in gerontology, and I'm also a senior researcher at the Research Center on Aging. My goal today with you is to share my views in order at the end of the session to have a conversation. I will be covering 3 points. The first one will be action to counter mistreatment of older adults in Quebec. The second one will be a tour of the world about what happened in the first wave of COVID-19 and the links with mistreatment of older adults. And finally, I will finish by the lesson learned. So let's start by action to counter mistreatment of older adults in Quebec. So you may be surprised that I'm talking about Quebec and not about Canada. It's because Canada is 10 provinces and 3 territories, and each of those jurisdictions are working very differently regarding mistreatment of older adults. So in Quebec, the first plan of action was released in 2010 and created 4 structuring measures. The research chair on mistreatment of older adults, where I am at. They also paid for some advertising campaigns, which actually were showing and all different type of abuse and violence against older persons. So it was really to raise awareness. They also created new professionals that are in charge of coordinating all professionals that are involved in cases of mistreatment of older adults. We call them the regional coordinators. There are 20 all around the province. And finally, they paid to have a professional helpline open from 8 in the morning till 8 at night, all days a week. And also during the night, the helpline is open with answering machine, and people will get a call back very rapidly. What is very important about this line is also that it can help professionals who need guidance in cases of mistreatment of older adults. This plan was in action between 2010 and 2017. The implementation was evaluated and it was very high. In 2017, the government also released a second plan of action, which you have at the bottom of my slide, and it's in force for 5 years. So it's going to be there until 2022. What was new in this plan of action? Well, the introduction of a wellness care approach, which can be called good treatment. And in French, we call it bien-traitance. They put also a focus on material and financial mistreatment. But one of the very important things that happened for us in 2017 was the introduction of a law on reporting of mistreatment of older adults and vulnerable adults. And this rendered mandatory the reporting for older adults in long-term care institutions, and also for all persons under guardianship, so the persons who have been declared incompetent. I think what I would like you to remember is that in Quebec, we're really working on an intersectional approach in a continuum of services. That is said that the police has to work with the public health and social services, has also to work with nonprofit agencies, has also have to work with the guardianship office and so on. So we recognize that there's not only one professional responsible for countering mistreatment. During the first wave of the pandemic, even though I really think we have a strong plan of action and there's some money to change services, we saw very terrible effects on older adults. Actually, 97% of our deaths were people aged 60 plus. And they were mainly in institutional care settings and also in congregate housing. What was said was the lack of care and support in those institutions. So they transferred older adults from hospital to those institutions, but they didn't put in place more services. There was some understaffing. There was some staff moving from one place to the other, so working part-time in different institutions who actually carried the disease. There was a lot of people sick and also some people who were afraid, so they didn't go to work. So there was not enough staff. There was a lack in infection control, a lack of equipment, a lack also in the control of hot zones for people with the COVID and what we call cold zone for people who were not having it. Two things really actually captured my attention. The first one is that in April, our premier of the province called institutional neglect what he saw as being something terrible linked to the way we actually manage the pandemic. So it's very important in the mouth of a premier to say that. Also, in September, the Ombudswoman of Quebec did a very severe report saying that we had structural problems in those institutions. And those problems have been pointed out many years ago, but nothing was done to be changed. There was a lot of investigation, and probably one of the things I would like to share with you because it really cut me was a testimony from one person working in those institutions and actually working with people who were dead, and they said that they found some dried tears on their cheeks, showing that these people died in a terrible disarray. I would now like to look at COVID-19 and mistreatment from a worldwide perspective. I had the pleasure at the end of June and early July to conduct a survey for the International Network for Prevention of Elder Abuse. And I had members from 16 countries who answered to our questions. And they really raised a series of general concerns. So they said there was a lack of compiling data on dates of older persons. So older persons were invisible in this situation. We also had a lack of gender and age disaggregated public data, so we had to search for it. There was, in that period, limited access to non-COVID health services, like let's think of people going for dialysis or also having treatment for cancer. And for sure, there was a lack of provision of home-based services. So people living at home had no help for groceries, cleaning, paying the bills, etc. When we asked the International Network for Prevention of Elder Abuse member what they witnessed in residential care facilities, all of them said that they saw psychological mistreatment, some neglect, financial, and also some physical mistreatment. We had not put on the list social mistreatment, but some people added it and saying that refusing visits from family was a form of social mistreatment. Regarding the violation of rights, our NPA members also raised a series of concern in care institutions. It's very clear that the pandemic has shown a lot of ageism. You maybe heard terrible things like the fact that COVID-19 was a boomer remover. There was some civil rights denial regarding safety, dignity. For sure, there was a lot of limitation of social contacts, and those limitations may have had more impact on older persons than younger ones. It was very difficult for a lot of people when they saw that they were refusing visits from family, and also family really complained that there was a lack of communication with the management and the practitioners and institutions. So they were without news from their older person. They were also not capable of getting in contact with certain older person. And for sure, even in more terrible cases, older person died without their loved ones close to them. So there was no distinction between hot zone and cold zone. There was some understaffing, and there was a lot of lack of guidelines on mental and physical health. So what have we learned? Well, I think we've learned a lot in this situation. First of all, we've learned that we have to look not only at violence against older adults, but also at neglect of older adults. And the neglect can be in the caring, but the neglect can be in the support. The neglect can be in the lack of communication. The neglect may be in the fact that we were isolating older persons, and actually they didn't have a lot of choice. Actually, everything was imposed. And I want to be very clear. I think a lot of measures were imposed to people from all ages. But in cases of older adults, what was more difficult in my point of view is that their voices were not heard. They were kind of invisible. And for certain older persons, especially the ones in good shape that were living in congregate housing and really had to stay locked in their apartment, or people living in their own homes, they felt that we were treating them as if they were kids, not capable of making decisions. So there was a lot of questioning between the balance between the necessity of having strong measures in a context that was very difficult, but also looking at the rights of people and also the rights of the families. I'm quite concerned, especially for older persons in institutions, which actually have no way of communicating if they have a lot of physical or cognitive incapacity or limitation. In those cases, the families are often their only voice. And when we did cut the contact, it was terrible. So one of the lessons that we learn now is for a second wave, we have to find ways of keeping communication between families and older persons, and also between families and institutions. We have to listen to the voices of older persons because they are capable of making certain decisions from themselves, and we have to hear what they have to say. The other thing that we've learned in this crisis was the importance of getting prepared. I don't know for you in Spain, but for us in Quebec, it was clear that we were very well prepared in hospitals, probably because we've learned about what happened in Italy, but also in your own country. But we were not prepared at all in institutional care settings for older adults. So like I said earlier, we need more trained staff. And during the summer, the Quebec government has launched a new program to actually train in a rush new care workers to be in those institutions. We also needed to train people on the control of infection or the control of how not to spread the disease, because we saw that a lot of time it was staff that was spreading the disease. We also learn now that we need some equipment in nursing homes. So we don't need to keep all the equipment for hospitals. We have to share the equipment with nursing homes. The other thing that we've learned, and I think this is a very important point, is that we have to look at it from a perspective of the rights of older persons. And I don't know if you are aware, but for the past 10 years, there's been a group working at the UN, the United Nations, really trying to see if we need a specific convention, an international convention on the rights of older people. And more we think, we are a lot of people thinking that if we would have had such a convention, maybe the attention given to older person in time of pandemic would have been higher. So I encourage you to actually work with your government to be able one day to have that convention and to ensure that Spain will sign it. And my last point, and I'm sorry for my terrible accent in Spanish, but it's not only countering mistreatment of older adults. We have to promover el buen trato. So that's what I was calling bientraitance earlier in French. So in a combination of action to counter a problem, we also have to promote something positive in the way of working with older adults. If you want to know more about what I've talked, there will be a special issue published in a few weeks by the Journal of Adult Protection, where I have 2 papers to be published. And finally, I really invite you to visit the website of my research chair. It's fully bilingual in French and in English, and we put a lot of information in direct access. I look forward to our discussion in a few minutes. Thank you.